I now call you 4 minutes.
Thank you, Lass Kerlick. I too would like to welcome the Minister to the House this afternoon and thank him for coming in to discuss a very serious issue, I believe, concerning the HSE drug counselling services and programmes for under-18s in Dundalk. I've been in contact with local people who are acutely aware of the situation since the closure of the drugs counselling service for under-18s in December last. And at present, I'm led to believe that the Dundalk area has no HSE drugs counselling service for the under-18s category. I've been speaking with local Gardaí as recently as today regarding this matter, and they are very concerned with the lack of services for young people. And I think it's a testament to the Gardaí and the JLOs in the area in particular that they are working above and beyond and are very, very concerned about this whole issue. The Gardaí want to assist and work tirelessly to help these young people in staying out of the criminal justice system, but it becomes more difficult when the first port of call, the drugs counselling service, is not available. Drugs use and addiction continue to be a major local issue, and we should provide the supports and services necessary to assist young people in their recovery from addiction. The biggest local problem, I'm led to believe, is with benzos. People are buying them over the internet, they're being delivered and openly for sale, and with the amounts that they're taking, they're saying they're causing serious problems with their health. And I know even today they said with the contrast in taking E-tabs when they were popular and now the benzos, that it's a completely different reaction that they're having, where they actually appear to be unaware of their situations, and it's making it more difficulty for people like the JLOs to kind of help them. I'm aware of one particular case of a 17-year-old who refuses to admit that he has a problem and has been unfortunately removed from the family home. And as the JLO has said to me, normally the first port of call would be that he would say, well, we can help, but you must first go to drugs counselling. But when that's not available, their hands are tied in what they can do. And we all know, and I would say this, that I think from our early teens, they're the most vulnerable years, and it's recognised, I know, within schools that they are the second year in school is the most important year in determining, and can be, in which way a student would go. And I think that if we don't have the services in place for these young people in the drugs counselling, we're certainly adding to a growing problem. So I think, therefore, that it is imperative that we do have adequate and appropriate services available, which are easily accessible. And I know that private counselling, where it may be available, many parents who are in this predicament with their under-18s, they don't have private health insurance, nor can they afford to access it. So, Minister, I would ask you to outline why this service was discontinued for the Dundalk area at the end of last year. I would ask that you would also outline the future plans for drug counselling for the under-18 age group, and specifically the future of the services for under-18s in Dundalk. The service that is being sought locally, as I've said, would not be a full-time service. They're not looking for 5 days a week, 9 to 5. We're looking for maybe 1 day a week with a 2-hour slot, where young people can be directed from those that are trying to help them to access this unit, and where they can receive the appropriate help that they so badly need. Thank you.
Thank you, Senator. I now call on the Minister.
I want to thank the Senator for raising this important matter in the House today. The overall strategic aim of the National Drug Strategy is to tackle the harm caused to individuals and society by the misuse of drugs through a concerted focus on the 5 pillars of supply reduction, prevention, treatment, rehabilitation and research. Within this framework, the HSE is committed to achieving improved outcomes for people affected by addiction issues. Regarding the specific issue raised by the Senator, I'm advised by the HSE that the under-18 counselling service in Dundalk is still in place. HSE-funded services such as ISPCC Teen Focus Programme, a tourist counselling service and the Mead Jigsaw Initiative provide support to young people presenting with substance misuse in Dundalk and the wider catchment area. The HSE Addiction Services in Loudmeath refer appropriate cases for residential treatment and link with the HSE Specialist Adolescent Services in Dublin. Staff work with parents and guardians around their young people's staff work with parents and guardians around young people's substance misuse and liaise and provide support to services working directly with the young people concerned. The HSE commissioned a review of Dundalk addiction services last year to determine whether the model of care was adequate to address service user needs and to examine the adequacy of clinical governance arrangements underpinning service delivery. This included a review of the model of service organisation in the Loudmead area. The review team comprised an external psychiatrist, a GP coordinator from the HSE Addiction Services, and a general manager from the Office of the Integrated Service Area Manager, Loudmead Primary Care Services. The review was completed earlier this year. The report concluded that the existing model of service delivery in Loudmead needed to be strengthened in light of the changing profile of substance misuse in the North East, which the Senator has referred to. It recommended a number of structural changes in order to bring service provision in Loudmead into line with national addiction services. Among the changes recommended include the augmentation of the HSE team with specialist senior clinical personnel, restructuring of management roles to allow for an appropriate demarcation between operation and clinical management, and a review of roles and responsibilities of HSE staff. The report recommended the development of formal shared care working arrangements for service users in line with the National Drugs Rehabilitation Framework and the full implementation and monitoring of the Needle Exchange programme. It highlighted the need for a model of care to respond to the needs of young people who are dependent on drugs other than heroin. The HSE is committed to implementing the recommendations in the report and as a first step in this process has shared the report with the relevant staff in order to obtain their views and feedback on the issues raised. An implementation plan will be put in place to address the issues raised in the report. I want to assure the House that the Government takes the issue of drugs misuse extremely seriously and is committed to tackling this problem through all available mechanisms. My department is beginning to work on the development of a new national drug strategy for the period from 2016 onwards, and I intend to play an active role in the development of the new strategy and look forward to engaging with all interested parties in this work.
Thank you, Minister. Senator, do you have a supplementary question?
Minister, thank you for your reply. Unfortunately, I can categorically tell you that, speaking with them this morning, that the HSE service in Market Street, Dundalk, which deals specifically with the under-18s, has ceased since before Christmas, and I would ask that you would look into this. I mean, telling somebody that they can go to the Meath Jigsaw programme if you're living on the far end of County Louth and you've got a drug problem and you don't have the supports at home, you know, it's just causing a huge problem. I mean, and even in terms of transport, about how they're going to get over. You know, as I said, the Gardaí and the GLOs are, you know, and they wouldn't come and they wouldn't show their concern if they didn't think that it was a huge problem where they can't access it in the town, where they were right in the middle of the town in the HSE there in Market Street. So I would please ask that, you know, you would look at this again you know, let's get a straight answer to it, because, as I said, other providers are there. They could involve private counselling. But, as I said, a lot of the people that are caught up in this are people that can't afford it. And I know that the Gardaí are seriously worried about the situation.
Thank you, Senator. Minister?
Look, what I'll certainly do is I'll ask my officials to check in specifically to the service at Market Street, which you refer to. And it's always a possibility that the information I've been given is incorrect, but given the scale and breadth of health, it's just not possible for me to be au fait with every individual service in every town and county at relatively short notice. But what I will do is ask my officials to look into that specifically and come back to you later in the week with a full reply by correspondence.
Thanks very much, Minister.
Thank you, Minister.